So here we're today with Eugenia, and Eugenia has been a long time patient. You've been a patient for how long, Eugenia?
Since 1991.
Wow, okay, so that's 23 years, and we know that you originally came with the carpal tunnel problems.
Yes.
And weren't they going to do surgery with you at one time? Did they ever talk about that?
No, I never went to a doctor.
You never did. I know that you're kind of anti-doctors.
Yes.
Anti-medications.
Yes.
Do you mind mentioning your age?
No.
Or no? Okay, what is your age?
I'm 80.
80. And how many medications are you on?
Nothing.
Nothing. And when you've gone to the medical doctors, for evaluations, what has the responses been like when they ask you, have you been on any medications?
What is their response?
Yes.
Well, I'm very fortunate. I have an Armenian doctor, and she's very much into appropriate food, let me put it that way.
Oh,
so she
good.
wasn't surprised.
Oh, good. That's fantastic.
Because her culture eats like my culture.
Oh, that's good. So I know that, the blood pressure has been a big consideration. Dr. Leonard and I both, done your blood pressure before. It was up at about 229, for people that understand that's systolic, and about 110 diastolic, which is both are pretty high when we think about the normal being about 120 over 80. Now, with your blood pressure, we started putting you on something, the biocardial cert. And you've been on that for how long now?
Since February.
Okay. And your blood pressure's gradually dropped.
Yes.
And it's gone from 229 to 180 to now today, what was it?
151.
Yeah, 151 over like 64. Now that's spectacular. Now when we did your left side, because we did both sides, remember that? So we check your left side, and a lot of times people don't understand that it gives us an idea of brain function as well, So we checked your left side, and your left side was 147 over 64. Wow. And so I know that you've been committed user. We've had you on all kinds of supplements before in the past. Yes. But what would you say to this? Because there's going to be people out there that are going to see this, and the blood pressure. I'm going to put this on YouTube as well. So what would you think of this whole process of being able to do it naturally? Because do you know how many drugs it takes in order to reduce your blood pressure, like by, I think it's 15 or 19 points?
No, I have no idea.
2 medications.
Really?
Yes, isn't that amazing?
It is.
So, anything else you want to make a comment on?
Well, I'm very pleased that you put me on this supplement and that you wanted to support me that much.
Yeah.
And I hope that interview will help people.
Right.
And I'm very appreciative that you are so much into nutrition as well as body care, and how I started and where I ended up, and I plan to continue if I go on.
Right.
80 is an old age.
Yeah.
So who knows?
Who knows, right? We don't know.
Right.
Just like we were talking before, a lot of people don't understand that really, Jack Lane was not only a chiropractor, but he was big in the nutrition, the juicing, everything else. He took approximately 60 supplements a day. Isn't that amazing?
That is.
So we know about Dr. Oz, of course, but really the chiropractic profession is always the one that said no to drugs.
Yes. I'm sure you're done with me now?
No, go ahead.
With Dr. Oz,
yeah,
there are times where he will get people outside of his profession, which I give him credit for it. And he will say, I didn't know this and I didn't know that. I like that idea because I do watch him.
Yes.
But there are some things I feel that he swings too far.
Right.
And of course, he's a doctor, so his
doctor,
training, but he does admit that a lot of things in medical school he has not learned, and he is learning on this program.
And that's the way we all basically learn.
Yes.
Thank you so much.
Oh, you're welcome.